A lap band fill is a procedure that the doctor performs in the office in order to adjust the amount of fluid in the band. The goal of adjusting the amount of fluid in the band is to make you feel full on a meal that's about the size of a deck of playing cards, and also to stop you from feeling hungry for about 5 to 6 hours later on.
Hunger is the key concept that we are trying to eliminate from these patients' lives. And the band does a good job at doing that, but it's got to be properly adjusted.
The patient comes in for a fill, we have them fill out a brief questionnaire in the reception area, and they answer questions about what they're typically eating, how hungry they are, what exercise they're doing, and if they're having any problem symptoms. We then weigh them in. We enter their weight in a database, which gives us a nice summary and snapshot of what their progress has been with their weight and their band fills. We then chat for a few minutes, decide if they need a fill. If we agree they need a fill, they'll hop up on the table. I swab over their port with a little alcohol swab, pop the Huber needle in the port, add some fluid. We flush the saline in and out to be sure that we've accessed the system appropriately. The patient then drinks a bit of water before they leave, so I make sure I haven't completely blocked them off. And we instruct the patient then to do liquids 2 days, pureed for 2 days after any fill. The fill visits, the follow-up visits are very brief. They're in and out of the office in about 10 minutes.
My typical adjustment process is to begin the adjustments at around 4 weeks and do them every 3 weeks until the band is tight and stays tight. Early on, every time we do an adjustment, it's tight for a little while, and then the adjustment feels like it fades a little bit.
Based on what you tell the doctor, he will be able to assess whether the band is too loose or too tight, and accordingly the doctor will be able to put some fluid in the band, or sometimes even remove some fluid from the band in order to achieve the desired amount of restriction.
What is unique to the Allergan lap band as opposed to any other band out there is that it gives the doctor what's called tactile feedback. In other words, we get a little bit of back pressure on our thumb as we inject that band, so we can tell, independent of what the patient tells us, whether the band is too tight or too loose. No other bands give us that kind of tactile feedback, so it allows us to do a much more precise adjustment in the office.